Hi, and welcome to Spoonful of Strength. I'm Rachel, and I live with multiple sclerosis, type 1 diabetes, and a few other diagnoses that keep life interesting.
And I'm Tina. I am a fibromyalgia warrior with chronic back issues and a proud stage 4 cancer survivor. We're sisters, and together we're here to support, inspire, and connect. So if you're new here, the spoon theory explains how we navigate life with limited energy or spoons.
And we're thrilled to share that we've been ranked number 30 on FeedSpot's Top 100 Chronic Illness podcast list. So grab a spoon and let's dig into stories, tips, and a whole lot of strength. Welcome to Spoonful of Strength. We're really excited for today. We've got a jam-packed episode of topics that we're going to talk about today. We are first going to talk about the question, is your mental health being ignored by your doctors? That's an important topic of making sure our mental health is being cared for just as much as our physical health. In part two, we're going to welcome in Laura. Laura is the founder of Let's Talk UTI and has been living with urinary tract infections since the age of 2. So she's going to talk about her chronic illness as well as talking about the Let's Talk UTI program. So, well, let's start here. How's things going, Tina?
Good.
Good.
Beautiful weather up here. I feel like the heat's finally starting to break a bit around here.
I think yesterday was okay, but for us here in Indiana, it's going to be like in the 90s the next couple of days. So
I think it's
can't
coming
really get a
back.
break. Yeah.
Yep.
Yeah. I wanted to start off the episode by asking a question. So, with fatigue days or quiet moments, what is your go-to either show or song that when you're not feeling like getting up and face the world that you can kind of snuggle on the couch and listen to or watch?
My go-to, and it's funny, Dave always gives me a hard time about how much I watch these type of shows, but usually if I'm laying around and watching television, the Investigation Discovery Channel is on.
I'm just saying, I don't think I want to get in any trouble with you because if that's the kind of shows you watch, not only would you be able to kill me, but you'd probably get away with it if you watch that many shows.
Yeah, he jokes around and tells people that I watch it all the time and that I keep a little notebook at next to me on the sofa.
Oh, that's funny.
Which I don't, honest, really and truly I don't.
Okay, well, we'll see. But a little nervous over
How
here.
about
So I am wrapped up in drama shows. That's kind of my go-to. And currently I'm watching Virgin River on Netflix. I think it's got like 6 seasons. I'm like on season 3, but it's a really, really good show. And so I try and watch one episode a day because I've got if I have time and then there's another one called Sullivan's Crossing, which is made by the same creator. So the stories are a little bit similar, but that one's really good too. So I like the heartfelt dramas and they
well
sucker me in.
that's funny yep, because I love Virgin River and I literally just started watching Sullivan's Crossing last week.
Oh my
So
gosh,
those
that
two
that
are
one's good
also
too. Yeah.
yeah, yeah.
Yeah. Well, I'm only on season 3 of Virgin River, so you can't tell me anything that happens
I
past
won't tell.
season 3, but it's always
Yep.
nice just to have those shows where you can just relax and get your mind off everything for just a little bit. So, you know, but well, let's talk about mental health. I feel like we've talked about it in the past, but I really wanted to dedicate this whole show to talking about it because it's so important. Um, so we asked Instagram the question, is your mental health being ignored by your doctors? And we did get some responses. K Maxwell 1126 said, my primary is amazing. She encourages me to stay in therapy and likes to check in monthly when I am up for it. Other doctors don't. That's really amazing to find a doctor that's going to take care of the whole picture, including the physical and the mental. So I'm so happy that you found her. I feel generally where I'm at the UK, chronic conditions and the impact on our medical health are ignored, or doctors just don't have the time to listen. I've lost faith in the medical system here. I find it's easier in some ways to get help and definitive treatment when it's a physical illness. And I certainly agree on that. I think that we're set up to be able to get care for our physical self, but it's a lot harder to find somebody to take care of our mind as well. So now that we know what Instagram thinks, let's talk about it. Explain, I guess, explain to our listeners like what your history's been as far as mental health. Have you experienced challenges and kind of where have you been on that journey?
Oh yeah, sure. I can't imagine going through any type of chronic illness or health crisis without struggles. So, I definitely went through, I go through depression, anxiety, anger at times, frustration,
Mm-hmm.
all your typical emotions. And it can be so easy to get stuck down in that hole
Mm-hmm.
when there's a lot of things hitting you all at the same time, or that
Yeah.
you're when you're just feeling when you're feeling overwhelmed, then I find it very easy to start, to where my mental health and mental focus and start to really deteriorate.
Mm-hmm. Yeah.
How about you?
I I I don't think I have ever had any mental health issues up until my diagnosis of MS. And I went through a lot of changes after I had to stop working and thrown into quote unquote normal life and taking care of myself being my job. And I, that was, gosh, 9 years ago. And it's, it has its ups and downs, as many people can probably relate to. But I've done a lot of therapy and taken some time to try and learn how to communicate to Ed or my family, tried to use certain things to kind of um, help get out of that hole a little bit. Um, but I've actually I was interested in the amount of people with chronic illness that can experience depression or mental health. And on average, about 20 to 25% of individuals with a chronic medical condition are estimated to have major depression. Upwards of 35 to 50% of people with chronic pain, with some studies estimating up to 60% in certain groups. To think about those numbers, I mean, I thought it would be a little bit lower, so I'm a little bit interested in the fact that there are so many people with chronic illness affected by mental health.
Yeah, that's it's terrifying numbers, really, when you think about
Mm-hmm.
that. And it's because we're just going through so much in general. Do you feel that doctors or the medical field, there seems to be this distinction between physical health and mental health?
Mm-hmm.
Do you feel that you get mental health support, or through your doctor, your other specialists that you see, do they even tune in and ask about how your mental health is?
I would say on average, most of them do not. Um, my neurologist, not my neurologist, but the nurse practitioner has asked me, like, how are you doing? And I'm open to how I'm doing mentally. And usually what that means is, well, let's put you on some medicine. And I really wish that number one, doctors were more open to doing therapy first, unless it's a extreme case. But I also wish that mental health was more affordable and covered better by insurance because it's almost like you have to choose between, well, I can't afford both, so I have to kind of go this route of taking care of my MS and try and deal with the mental part of it on my own. And so I wish there was some sort of integration where mental health therapists would be able to join up with especially specialty doctors for things like MS or lupus or these major chronic illnesses, of being able to almost have like a joint communication. I mean, you can go to your regular doctor and say, my back's hurting. Can you get me to a back specialist? And they're able to refer you. That doesn't happen with mental health. You don't get a referral for a therapist. I mean, I guess if you ask for one, maybe, but I just really wish that there was a way that people with chronic illness could afford that because it is so hard dealing with the mental side of the chronic illness.
And I know within some insurance policies, they limit the amount
Hmm.
of visits you don't, which just blows my mind because they don't limit the amount of visits you can go have to to a doctor, a medical
Hmm.
doctor, but they'll limit you how many times you can see a therapist a year.
Yeah, yeah. I have my therapist has been with me since probably 2017, and we had a I was with him for like 5 years. Well, his practice quit taking insurance, but he was lovely in that he gave me a very discounted rate. But even that, I haven't seen him in months. Would I like to go? I feel like going maybe every 2 weeks would be helpful. I'm dealing with a new diagnosis and a upcoming surgery and a lot of things right now. But unfortunately, right now, I'm limiting it to what I can afford. And that's just I almost wish that they had a program where if you had a chronic illness, you would be able to get mental health therapy either discounted or insurance would cover it.
Right. Yep. Yeah.
But now I will say is for some of you that maybe can't afford seeing a therapist, my therapist has interns and they are in their very end of their education and they offer discounted rates up to like, $20 a session. And so if you're looking at a $150 session for 50 minutes and that's not something you can afford, definitely call around and ask if they have discounts with people who are still learning their practice and they're supervised by the certified therapist. So it could be a way to be able to get that service. But what's your thoughts on chronic illness and how that relates to the mental health? How does it affect it, in your opinion?
I feel like it definitely can have an impact. For example, as you said, you're struggling more mentally because through as you get another diagnosis. So of course that's going to be that is in my mind is kind of I have a hard time separating the two because to
Hmm.
me, they're all so co-joined that of course you're going to struggle mentally with finding out that there's yet another illness or disease that you're dealing with when you're, especially when you're already dealing with ones that aren't.
But even those people that are not yet diagnosed and the frustration of getting the test results coming back clear and doctors eh, not understanding your pain, and maybe
Mhm.
you're not with the right practitioner and you're having some medical gaslighting, or maybe you're dealing with family that doesn't support or believe you, and or just the daily dose of pain, fatigue, and discomfort of that being so overwhelming, of just dealing with it every day is is just so hard. I can't see that it can't affect your mental health. I mean,
Right.
I feel like that's just a part of it.
Hmm.
But
And especially, like you said, with the medical gaslighting or the family members that, don't believe things, you may start doubting yourself. If you keep
mhm,
hearing, oh, it's all in your head, or you're making it up, or it's not that bad, even though you know it's that bad because you're living it on a daily basis.
mhm,
But if enough people are telling you, and especially the professionals saying, no, there's nothing wrong with you, all the tests come back fine, or then you're going to start, that can set you down a really bad path of a really bad mindset path.
mhm. And even the uncertainty of the future, whether your illness is kind of stagnant or if it's progressive. I know for me, my therapist has asked me many times, are you worried about your future? Are you preparing for the future? Which I'm having a really hard time with mobility getting worse, and just the uncertainty of what am I going to look like in 5 years or 10 years, or um, you know, uh, my son just got engaged and they're probably going to be getting married in a year. And I think about, will I be able to walk down the aisle without my walker? Probably not. Will I be able to dance with him? I don't know, because I can't stand for long periods of time. And so those are things that are kind of current right now, of just feeling overwhelmed by, there's no map to MS. And so nobody can tell me what it's going to look like. I could be exactly the same as I am today in a year, or I could be far worse. And even that part of it, the grieving of what the things that you could do, it can just be overwhelming.
Hmm. Hmm. And what do you think? How about the, I don't want to call it false hope, but the hope that there's so many clinical trials.
Hmm.
Oh, well, maybe they'll come out with something that obviously can't reverse the damage, or the it can't reverse what's already taken place, but it could stop it from progressing more. Do you feel like that is also kind of um a kind of dangerous balance regarding your mental health?
I actually saw something online yesterday that said they're working on something that might actually rebuild the myelin. With MS. Myelin is, think of it like a covering over the nerves, kind of like a jacket, and the MS eats away at that myelin. And so I saw something the other day about, there could be a chance in the future that they could actually reverse that. I'm not one that gets real hopeful. I mean, I try and stay positive, but you know, uh, honestly, some days I'm like, even if I'm exactly the same as I am today, it's going to be hard. Like, even if even if nothing ever gets worse, it's still going to be a
Mhm.
really hard life. And although that seemed very negative, but it's I try not to get hopeful because I don't want to be disappointed. I'm much more
Mhm.
of a realist of thinking, okay, prepare yourself, but understand kind of where you're at now. But, you know, I do you think that, or why do you think that mental health isn't prioritized in healthcare? There, I feel like the stigma of healthcare is better, but I still don't see that connection between your doctors and the mental health part of it.
That's a hard question because I really don't know where the disconnect is. I don't know the process of, medical school. I feel that perhaps I'm sure that somewhere in their studies there is a mental health aspect, but maybe it's, is it just, you know, 3, 6, 9 credit hours, or is it more? So, they're so trained, especially those specialists, they're focused on the physical of what's
Mhm.
going on and understanding physically that I don't know if a lot of really take into consideration the mental health of how that patient is doing.
Yeah, and if you've got a doctor that's been in practice for 20 years, maybe that wasn't even that much education. I feel like mental health has come a long way in kind of breaking the stigma of mental health is okay, it's okay to talk about it, but so hopefully they are incorporating that more into, getting your medical license of understanding that and asking your patients, how are you doing mentally? Do you feel like you need a therapist? Would you rather do medicine or, incorporating that conversation into
Hmm.
every appointment, especially when you're dealing with chronic health.
Absolutely. Absolutely. And part of that also we've touched on how we feel that the the medical world has changed so much, that they're working so much that you don't have that one-on-one time with your doctor. So, really do how well do they know you? And they're like, okay, you got 15 minutes, let's look at this problem. And then they simply don't have the time in their schedule to address
Mhm.
anything else. Do you feel that it's almost like a different um, thought process, the doctors that go into like practicing medicine, like your specialists, your general practitioners, family doctors, and those that go into the mental health field just have a different way of thinking as well?
Yeah, I think that especially when you're dealing with specialists, I think sometimes what even makes a good specialist doctor is the fact that they are very smart. They may think more analytically. May a lot of specialists that I have seen just are very in tuned to their specialty. I do know that I think in the general practitioner area, I noticed in the last maybe 4 or 5 years that every year when I'm doing just my regular yearly visit, they'll have like a mental health sheet that I have to fill out that will ask questions about your mental health. And I think that's really, really good to do. But, and, but I don't think I've ever scored low enough that that conversation has had to happen. But yeah, I just think that the more specialty you get into, they're just more really focused on that area and almost can't see the body as a whole.
I kind of feel that way as well, that a lot of them are
Mhm.
just very analytically thinking.
Are you living with pain? We get it. And we're done pretending it's just a part of life.
That's why we use the universal heat patch from Spicy. Natural, clean heat, no meds, no mess.
It sticks on discreetly, moves with you, and gives you up to 12 hours of relief. No cords, no chemicals, just actual comfort.
Created by people who live with pain, for people who live with pain. Finally.
Grab yours at getspicy.com. That's GETSPICEY.com. And follow Get Spicy for real talk and real tools.
Spicy, because you deserve relief that works.
And thanks to Spicy for giving our listeners 10% off when you use the code SPOONFUL. That's spoonful with 2 L's at getspicy.com. If you had to think back, like what was your hardest moment? Is there a certain moment in your life where everything pretty much felt like it was crashing down? And what did you do to kind of get out of that hole?
Sure. Yeah, there's been a few moments in my life where it felt like that, and it's usually just a lot of things hitting at the same time. Bad relationships, of course, that type of thing. Um, but for me, one of the big things that helped was finding a therapist.
Mm-hmm.
Um, and making changes in my life that needed to be made. Um, whether it's for your physical health or your mental health, that always has to be priority. Um,
Mm-hmm.
and really just working on a big part of it, I believe, is training yourself on how to respond, how you're responding, if
Mm-hmm.
that makes sense. It kind of goes back to where I mentioned, it's easy to start feeling like you're spiraling.
Mm-hmm.
Um, and being able to kind of bring that center balance back to where you feel a little more in control of the spirals. You may still be spiraling, but you know, they're not as bad,
Slow it
or
down. Mm-hmm.
yeah, you're slowing them down. That really makes a big difference.
Mm-hmm. Yeah.
How, and how about you? Have you ever experienced that just overwhelming, almost at the breaking point?
Yeah, unfortunately, many times there were many times after I was diagnosed with MS where it was overwhelming to go from having a job and working to not being able to work and just your life being completely upside down. There was a lot of times where really struggled with self-worth after not working. And there were moments where I was very critical, self-talk was very negative, and moments where I felt so overwhelmed that I was like, this is too much. Like, this is too much for me to handle. And um, therapy definitely saved my life. It took time, it took a lot of effort, but the self-talk turned around. And that was the biggest thing that I could do at that point to gain some of my self-confidence back.
Of course, I'm very grateful that you were able to find that therapist and helped you through finding healthier coping mechanisms.
So we're going to put these in our description, but for the US, um, You can call or text 988. It's available 24/7 for the suicide and crisis lifeline. And then there's a crisis text line if you text home to 741-741. So if you're in a place where you can't see yourself getting out, then those are definitely crisis resources that are available. If if you have support and can find a therapist, do whatever you can, whether that be, like I said earlier, finding a more affordable option or looking into free programs. I think even some health insurance, I think my husband's health insurance has like it's limited to maybe 3 sessions or something, but like a place that you could go and get a couple sessions to at least get you started. So find the resources that are available.
That is always a tough yet very important topic to cover. But let's welcome in our spoonie for the week. Laura is the founder of Let's Talk UTI and the UTI Health Alliance, the only US-based patient advocacy organization dedicated to improving care, research, and education for urinary tract infections. Living with UTIs, and since the age of 2, Laura brings a powerful, lifelong perspective to her work, shining a light on the gaps in treatment and the urgent need for change. Through her advocacy, she empowers patients to speak up for their health and works with clinicians and researchers to ensure the patient voice is heard. Welcome to our podcast, Laura. We are so appreciative of you taking the time to join us and talk about your journey with chronic UTIs. Can you tell our listeners a little bit about yourself?
Sure. Thank you so much for having me. Yeah, my life has been somewhat consumed by UTIs. I was um, first diagnosed when I was around 2 years old. I don't have a real verbal memory of that because I was so young, but I'm now almost 60 and I have not been able to say goodbye to them. So I do have a long journey, many ups and many downs. So, yeah, and other than that, I have a family of two adult daughters who are lovely, and I have two giant dogs who my husband is now watching to make sure that they don't bark during our session. And yeah, formerly a professional musician, and also I am an ordained interfaith minister. So I don't know how it all fits together, but here I am.
Great. I didn't realize that UTIs were something that would be chronic.
Yes.
So you've been dealing with this for nearly 6 decades. Can
Mhm.
you share what the early years were like and how it's evolved over time?
Yeah. Um, so as I said, I don't really remember too much about the early times, especially before I could talk. But I do remember what happened when I was around 4, which was quite traumatic and I think has affected my entire life. Um, I had to have surgery eventually, but that was determined by this procedure called a bladder hydrodistension. And I was 4 years old. I was in the office with a urologist who was a middle age or old man. He seemed like an old man to me. And my mom was sent to the waiting room. And he proceeded to put a lot of water, that's why it's called bladder hydrodistension, into my bladder through the urethra and basically stretched it to the point of extreme pain with the water. And that has been a diagnostic thing or possibly something that helps people throughout my entire lifetime. Did it help me? I don't really know because I had surgery right afterward. But what I will tell you is that it was so traumatizing. I didn't know what was happening to me. I had no parental support. It was extraordinarily painful. It's now done under general anesthesia, and I was completely without any pain relief or anything, as far as I know. I was definitely awake. So that really got the whole sort of my emotional state kind of dysregulated around this. And then I had a procedure, which I have been told since was probably unnecessary to correct what they said was a stricture in my urethra. And I've been told by two urologists since then that was probably unnecessary. But that was further trauma. And further trauma to the tissues, the tissues under surgery and being sliced open, that creates kind of a different um, urobiome for bacteria and things to settle into. So, as far as I know, that I can remember is I don't think I had many problems after that until I became sexually active around 18. And at that point, that was around my first semester of college. In my first semester of freshman year, I had 13 UTIs, always given short
Ugh.
course antibiotics, and they would always come back, which would now be described as a recurrent UTI. Um, I didn't really know what was going on. It certainly affected my life in many ways. And then I did get to the point in my mid 20s where antibiotics just did not work for me at all anymore. And I was literally peeling like tomato soup. It was blood straight up.
Oh.
And then I found a homeopathist, and she also did acupuncture that that really helped me. It was very much a different treatment plan, and that helped me for a long time. And in fact, when I got pregnant with my two daughters, throughout that time from like 29 to 39, I really didn't have that many problems. I really feel like maybe it was a hormonal change during pregnancy. Many people have an opposite reaction. They get worse symptoms during pregnancy, but I was very fortunate to have that break. I was also very resistant to seeing doctors at this point because of the trauma that I've experienced. And I got to the point once my girls were a little bit older where I didn't have that hormonal boost, um, where I was in such desperate state with my infection and I had to seek help. So I basically found a urologist who seemed to be a sympathetic person. And I sat in her office for the time that I was there and cried the entire time. My husband was with me and he helped me like speak. And she she was so helpful. She was super helpful with the way she showed up as a person. And did she have many options for me as far as treatments were concerned? No, because there aren't really any. Um, but just the fact that I was seen during that appointment, like really seen, was a change, a huge change. And I started to trust a little bit again. And then it took about 5 years for me to agree to have a cystoscopy, which is where they put a camera into your bladder and urethra and they look around. And apparently that was normal. Um, this happens to a lot of patients where the cystoscopy looks normal, where there's still severe problems. And for some reason that's not caught. I don't know why, but that is something I hear quite often. And then, as I got into perimenopause and menopause, the symptoms just got so bad that I began to not be able to work outside the home. And I, basically was bedridden or chained to the bathroom, one or the other, because the frequency was so bad that I would have to go pee every 10 minutes. And that is pretty much unlivable. I have tried so many different therapies, which maybe we'll get into, but the latest thing that I've done, which is kind of a little bit of a desperate measure, is I had bladder fulguration surgery in March of this year. And um, I'm about 4 months out now. And what that surgery does is it goes into the bladder and they put electric, some sort of a cautery kind of a thing into your bladder and it scrapes away all the tissue that's unhealthy. My surgeon said that he had to do more work on me than most, and I think that's why my recovery has been a little harder. But so far, I'm feeling some good response from that. I'm only getting up in the middle of the night like two or three times instead of like eight or nine, and that is a huge help, just that by itself. But definitely the pain is still very acute, and we'll just have to, hopefully that will go away after a little while. Yeah, but that's kind of my life story in a very short nugget. My life story with UTI. I have a big, gorgeous life outside of UTIs.
I think most people know what a UTI is, but can you explain what
Sure.
what makes it chronic and what a UTI is for our listeners who maybe aren't familiar with that?
Yeah, absolutely. Um, a UTI is a bladder infection, is an infection of the bladder or the urethra in that area. There's a kidney infection, which is an upper um, urinary tract infection, which is a kidney infection. Many UTIs can get into the kidney because they aren't treated well. Fortunately, I have not had too many problems with that, but many people do. What the symptoms are, because if people haven't had one, they might not know. Mostly, if you do have one, you know, because it is so loud. The pain and frequency and the general all over body feeling terrible is so, so loud. So the symptoms could be like, especially if if you're having your first or second one, is very like peeing shards of glass. That's what it feels like. And then as soon as you do that, you kind of feel like you have to go again. And it's really scary because you have to pee shards of glass again. And it's not actual shards of glass, but that's how it feels to me. And many people have described it that way. And so that's kind of hard to ignore. Like people will know when that happens. Also, lower abdominal pain. If the infection's in the bladder and the pain just doesn't go away. Frequency, peeing many, many times an hour and not being able to leave your home because of the frequency. Um, and urgency. A lot of people have urgency where they just suddenly have to go to the bathroom and they may not make it. So there are a lot of different symptoms. There are others, low back pain. It could be causing fog in your head. If you're a little bit older, that's a common symptom. There's so many symptoms. But I guess what I would have to say is it's a bacterial infection in the bladder, and it has to be treated. And sometimes you can do it if it's your first or second infection. Sometimes natural remedies work. Like there's a supplement called D-mannose, which is something that binds to E. coli, which is the most common bacteria in UTIs, and it will allow you to flush that E. coli out of your system. If you're just new to this, sometimes these kinds of remedies work. But as you get further and further along in recurrent UTIs, which are like UTIs that you either have like two in a 6 month period or three or more in a year, that's considered recurrent, it becomes harder and harder to treat. And then oftentimes people will go into chronic, whereas they don't have breaks between infections. So it's just constant. And it's a hard place to be. It's a very hard place to be. And the dismissal by the medical system makes it extremely hard.
Mm,
Yeah.
I
Mhm.
bet.
Yeah, it is. So, out of all of this, you founded Let's Talk UTI, which is the first patient advocacy organization that actually focuses on UTIs. What gap did you see in our healthcare landscape that made you say, I need to create this because there needs to be more out there?
Yeah, that's a great question. Um, well, so I was probably in my sixth year of having to be home and not working at this point. It was in what was it? December of 2022, probably. And I was searching high and low for a patient advocacy group for UTI in the US, and the only ones I could find were in the United Kingdom and in Australia and New Zealand. And I thought, why is our country not having this kind of representation? This doesn't make any sense. I did contact the people who are my colleagues now at Live UTI Free. They are just an amazing group, and they're in Europe. And I talked to them a bit about this, and I was just thought, well, I have the time, I have the resources, and I can do this from my bed. I can get up as many times as I need to go to the bathroom.
Mhm.
I can have my heating pad while I'm doing this, and I had no idea how to start something like this because, as I said, I was a professional musician most of my life, and normally we just don't do these kinds of things. So I just did what I could. I just started, my first task was to make a website, and I thought, there has to be some place that can sort of ring the bell and speak from the rooftops about what women are actually going through. Because women themselves don't actually talk to each other about it too much, because there's some sort of weird shame stigma around it when we have done nothing to cause this infection. But that's also a big misnomer, is that the woman has caused it in some way. Scientists have no idea really why it starts. They're working on it very hard and they're doing a great job. But there's still no really real resolution or proof of what is actually going on. Why some people
Hmm.
can fight it off and others just can't.
Hmm. Yeah, your website's excellent. There's
Oh,
so
thank
much good
you.
information
Mhm.
on there. How do you educate patients and also doctors about the importance of better diagnostic tools and also better treatment for
Yeah.
chronic UTIs?
Well, I think the reason I named it Let's Talk UTI is because that's what we need to do first, is just start making it a normal thing to talk about. Just like if you had a strep throat infection or an ear infection or a lung infection, that it's just another body part and there's nothing to be ashamed of. And patients, women, doctors, whoever, people can start talking about it because it is the most common bacterial infection in the world. And the fact that that is the case and it's not being treated more seriously is kind of beyond my understanding. So talking about it, getting our website out, making sure people know where they can find support through the Facebook support groups, those kinds of things. We've also worked with some researchers. We are part of a research group that we're invited to hear the microbiologists, and I don't understand much of what they're saying, but I can kind of get the general idea. But it's so awesome that they invite a patient group to be part of that because I think they really value the patient experience. And I think we're trying to make inroads into working with more researchers and also physicians just to have them understand that. I mean, I think the physicians really do understand this is a very difficult infection and that their resources to treat it are extremely limited and don't work for a majority of people or a large portion of people. And so that's what we're doing. We're just getting the word out as much as we can, being here with you as part of that.
Mhm.
And yeah, that's we try to do as much as we can. Social media has also been a big part. We've been doing a lot of social media, and I feel like that's really helped drive people to the website. And I think the website has a lot of educational materials on it and resources, and that's one way as well. I think if patients are more literate in what's happening with them, they can go to their appointments with more ease, confidence, willingness to speak up. I mean, we have a blog about how to advocate for yourself or how to build a support network because these things are necessary. Like I was crying in that doctor's office for the entire appointment, and I didn't have the information that I have now, but I had by that point suffered for almost 4 decades. So, I mean, patients need to be educated so that they can request what they need,
Mhm.
or at least just be
Yeah.
listened to.
Join Spoonful of Strength on Instagram, a community open to everyone. Whether you have a chronic illness or support someone who does, you are welcome at Spoonful of Strength. You'll get preview clips of the upcoming episodes and insight into my world as a spoonie. That's Spoonful of Strength, spoonful with 2 L's, on Instagram.
Yeah. But how important is building a community and helping managing a condition such as
Well,
chronic UTIs or really any condition?
yeah, really any condition. For me, a big change happened when I found out about the Facebook support groups. And it was so many well-educated patient, I would call them patient researchers, where they just had done so much research about this illness and trying to find whatever they could about what's actually happening with them. Because oftentimes people will get a negative test result and have a raging UTI. And that's because the testing hasn't been updated since the 1950s. And it was never meant for UTIs, it was meant for a pregnant woman with kidney infection. So the testing itself needs a serious update. And I know researchers are working on new testing models. They have not come to the market yet, but they hopefully will soon and they'll be more accurate. However, I know your question was different than this, but however, I just want to touch on testing one more time because
Hmm.
um, there are advanced tests, and we have links to them on our website that are available in the United States, and they work really well. They're like PCR tests, kind of like the COVID tests that we all used, or next generation sequencing tests, where they dive much more into like the DNA of what's happening. When the bacteria has burrowed down into your bladder lining, it's no longer free floating in the urine to come out to for those tests. And then you're told you don't have a UTI. Um, there are many other problems with why it says negative, but I won't get into that now. So just know that we have choices and we have to request those choices from our doctor. And we do have a testing page on our website for advanced testing. Um, but you talked about community. I just think for myself and my own experience, I found out about a Facebook group and I learned so much from these wonderful patient researchers. And what happened for me is I found out that there was a specialist or a couple of specialists in the United States that take on these kinds of very difficult cases. And you'd be surprised how many very difficult cases there are. There are a lot. And so I had to fly across the country to go see this person. And the reason I'm not saying his name is because he's inundated with patients. He's got a year-long waiting list, and I just
Hmm.
I
Wow.
would have to get his permission to do that. Um, but you can find out about these doctors on the support groups, and I immediately contacted him. I had to wait 5 months to see him, and this was a few years ago, and things have changed. I was able to get up and get out again because he put me on high dose or therapeutic dose long-term antibiotics. And then I've had the surgery with him as well. So I'm up and functioning again. It's still very hard, but I'm not stuck, which is a big improvement.
Mhm.
Some people are just stuck and then they get into major mental health problems.
What would you tell a person who is continuing to have UTI after UTI and feel like either they're not being taken seriously or they feel like something deeper is going on and
Mhm.
they're not getting that attention?
Right.
What would you say to them?
I would say you're absolutely not alone. That would be the first thing, that you're surrounded by warriors everywhere you look. There's not a time that I talk about my work that I don't hear a story from somebody that I'm standing next to in the bathroom or on an airplane or whatever. I hear story after story about it. Um, I would also say that they're not imagining their symptoms because they are told that often in healthcare settings, or that they should just go home and do yoga or have a glass of wine, which could actually cause more problems. Um, I would say that they should check out these support groups and that they will feel so held up and they can post their worries to the support group, and there are so many wonderful people that will respond. And the thing also that I would say is there is not necessarily a magic solution at this point, and that we this is not a pesky little woman's infection. It is far greater than that. It can cause death by suicide. It can cause sepsis leading to death. It's a serious problem, and it's I don't feel it's regarded that way in the medical community. Um, and I know I'm kind of skipping ahead here, but I feel like there's kind of like a gap between what research knows and what medicine and people in the medical field are taught or know. So, um, but I would just tell them to get involved with more research and these support groups because they'll feel held up and then they might be able to make further decisions from some of the recommendations that they see. And not that the people in the support groups are recommending a certain kind of therapy, but they'll say, I tried this or I tried that and it worked for me, or this never works for me. You know what I'm saying? And people can make more, more informed decisions.
Mhm.
Mhm. What changes would you love to see in the medical system regarding UTI treatment in the next 5, 10 years?
I love that. I think there needs to be a ginormous paradigm shift. Um, because as I said, this is not regarded as something serious. Although so many people lose their basic quality of life from this illness, and that is not being talked about. I would also say that the most important change until science can figure this out is to listen to your patients. I think doctors and healthcare workers need to hear how much suffering this is causing and to take it seriously. And the thing that's really sad is they don't have many resources at their fingertips. And so they're probably really frustrated too. But I think just a patient having a person understand and take seriously their symptoms is a giant step in the right direction because patients feel so much despair when they're suffering with extreme pain and other life-altering symptoms, and then their doctor dismisses them. What are the choices
Mhm.
at that point? So, we don't have necessarily the right treatment yet that's going to fix this, or the understanding of why this is happening to some people and not others. But what we do have right now at our fingertips is the ability to listen and to take seriously what's happening. And I do feel like by us doing this as a patient group, we're going to get this, the idea that this is very serious across and what's happening to patients across more and more and more. And that's our goal.
Mhm. Yeah. You mentioned earlier about the emotional toll or the mental health toll
Mhm.
of living with chronic illness and chronic UTIs. In earlier in this episode, Tina and I discussed the mental health part of it, how living with a chronic condition can affect your health. Are we really supported by our practitioners to understand the mental health of this?
Mhm. That's a huge problem. I think, as I said, there needs to be a paradigm shift, and that we need to teach practitioners that um, the mental health component can be just as loud and cause as much suffering as the physical. And I do really feel they're connected, physical and mental, because how could it not be if you're suffering so much and you can't do anything with your family, or you can't get together with your friends, or all the life, you can hold a job, all the life suffering that happens because of chronic illness in general. This illness definitely puts you in those spaces. um, that causes mental health problems, and I have been talking to a researcher, and I'm hoping that we might do some work on researching the mental health component of UTIs, because it's big. And there's a wonderful um, downloadable resource on our website called Hearing Patient Voices. It was a survey done by Chronic UTI Australia of 400, I believe it was 409 patients suffering from recurrent and chronic UTIs, mostly women. And they really outlined the mental health problem with this illness. And so if anybody wants to take a look at that, that's a great resource. But more work needs to be done on researching and proving to the medical community that this is a huge issue.
Hmm.
Mhm.
Yeah.
Sure does.
Absolutely.
Yeah, I'm sure you feel that with all, chronic illnesses.
Hmm.
Yeah.
Yeah, we were just talking about how eh, eh, you're especially specialists. They don't really ask about how things are going mentally, and when you have
Mhm.
a chronic condition or many chronic conditions, it it has to affect your mental health. And
Right.
so not feeling like they're just looking at the MS, or they're just looking at one piece and not looking at how that takes a toll, or maybe if you mention it, they throw medicine at you. And
Exactly.
so
Mhm.
Mhm.
it's really difficult.
There definitely is a need for, like, they tend to focus on, they treat the disease, they don't treat the person, and that is
Yes.
where
Yes.
the breakdown is.
Mhm. Yeah. As you were talking, Rachel, I was thinking, wouldn't it be great if a therapist was actually in the room during your appointment to address this so that it could be like a combined therapy rather than just you have all
Yeah.
these separate things. Well, so they're not separate, as you know.
Yeah.
Everything's
I
connected.
was actually thinking about that
Mm.
earlier. And I was like, gosh, wouldn't it be nice if there was a therapist inside every building, every
Mhm.
doctor's office had a therapist there that you could have access to and make it more of a combined, we're taking
Yeah.
care of you, your physical and your mental health. Yeah, that would be amazing.
It would be so amazing. And I think it's desperately needed with chronic illness. It just takes such a toll other than physical.
Yeah,
Mhm.
definitely.
Yeah.
Absolutely. Thank you so much for joining us on our podcast. Tell our listeners where we can find you. Rachel mentioned, and I checked it out too, your wonderful website. So let them know where to find you on social media, your website,
Okay.
and such.
That's great. Okay, so our website is letstalkuti.org. There's no apostrophe. And then on Instagram, it's at Let's Talk UTI. On Facebook, it's the three words Let's Talk UTI with an apostrophe this time. And oh, we just recently opened a TikTok account. I think it has one post, but we're going to make more, and that's Let's Talk UTI. Hopefully, we'll get that beefed up a little bit.
Yeah,
Yeah.
good. So much good information, and I'm so amazed by just how much we don't know. I had a one UTI in my life, and it was the worst thing I'd ever been through. And so to deal with that over and over and over, I my heart breaks for you because that was, oh my gosh, that was so much pain, and it was just a horrible experience. So I'm really glad that you were able to come on and talk about your website and give us a little insight into chronic UTIs. And so thank you so much for coming on today and helping us and learn a little bit more about UTIs. And
Thank you.
we really appreciate it.
I was happy to be here. Thank you.
She's so sweet. Like I said to her, I just never thought of UTIs being chronic, and I can't even imagine dealing with that on a daily basis or having them, 3, 4, 5 times in a year. It's they're just so excruciating, and so that's what I love about this is finding more information and spreading out the word for people who maybe they get 2 or 3 UTIs a year and don't realize that there can be a component to it, a chronic component. And her website, Let's Talk UTI, is just amazing, and it has so much information and so many resources. And yeah, I just thought she was lovely.
She was
Loved
very
having
lovely.
her. Oh yeah.
Yeah, I just recently had a bad UTI, right? Back
Hmm.
in, let's see, I was still on my antibiotics for it when I was out your way out in Indiana back in May. But it, like leading up to it, it had gone on for weeks, but for a while it wasn't bad enough that I was like, oh, it's getting better on its own. Oh, I think this might be it. I think this might be it. And so it really, like the symptoms, it was there and annoying, but not super painful enough to motivate me, even though I should know better considering I only have one kidney now, to not mess around with something like that. And it was interesting because when I initially went, and this is how when she was talking about, how outdated the testing
Hmm.
is for this. So the walk-in clinic that I went to, they can test, I'm assuming with the outdated test, um, right there on the spot to say if it's yes there's an infection, yes there's bacteria present, or no, but then they also always send out an additional sample for a lab to
Hmm.
pinpoint actually what the bacteria is. So the initial test literally said that there was like that the bacterial level was like really like it was there, but like barely there. So he still prescribed antibiotics for it. But then when the actual lab test came back, like the level of the E. coli, which she had mentioned was the most common bacteria, was like I thought it said something like normal is under 10,000 units, however it's measured, and mine was testing over 100,000 units.
Mm,
So like I showed it to Judy, my sister, Rachel's sister-in-law. She's a nurse practitioner, and I showed it to her, and she was like, "You are lucky that that did not end up in your kidney because you would have been in the hospital from it." So,
yeah,
even the
yeah,
testing made it sound like initial testing made it seem like it wasn't that bad
that big of
until
a
it
deal.
actually came back. Yeah.
Yeah. And I love how she talked about the stigma of UTIs. Same with like stomach issues or bowel issues, things like that. There's just something weird about being embarrassed to talk about the issues that you have.
Mm.
And that I'm glad that she talked about that because it needs to be, just as her website says, it needs to be talked about and learn a little bit more about, especially if you're struggling with those UTIs. So great
Yeah.
episode.
Yeah.
I,
Yeah.
I
Definitely
think
check out
all
her
in all,
website.
hmm
Yeah. Yeah. I feel like I could think of another 10 questions I could have asked
yeah,
her about that, about
yeah,
chronic UTIs and such.
yeah, I think so too. We could have turned this into a 3 hour podcast
Yeah.
of
Yeah.
just our
Just
conversation.
talking
But
about you, just talking about
yeah,
UTIs. Yeah. Yeah.
yeah,
That is something that I never really growing up wasn't something that I dealt with on a regular basis, but I have ever since my urothelial cancer. I do notice I've been getting not to the point of even being reoccurring, but
mm,
one or two a year, which is more than what I used to have, up until then, maybe one or two my entire life. Thank you all so very much for joining us this week on our podcast episode. And we cannot wait to have you join us again on our next one. So be sure that you're liking and subscribing so that you're in the loop and know when we have new episodes coming up. And until then, take care of yourself and be sure to save some spoons.
thanks for tuning in to this episode of Spoonful of Strength. We hope that you found a little inspiration and maybe even a new perspective to carry with you.
If you enjoyed today's episode, don't forget to hit that like button, follow us for more, and leave a comment. We'd love to hear your thoughts.
And if you're feeling generous, please take a moment to rate and review the podcast. Your support helps us reach more spoonies just like you.
Until next time, remember to take care of yourself and keep finding strength in your story. Bye for now.
And see you next time on Spoonful of Strength.